And so what we need to do is implement a screening approach. And this is kind of a sample cartoonish version of what we have in our lab. We've got a 12-column switching valve in which we can screen 12 different columns, a combination of different mobile phases, set this up to automated screen overnight, and then hopefully in the morning come in and find a nice baseline resolution or at least a partial separation that we can begin optimizing in our next steps. I will be covering quite a bit of the method development strategies in this talk, but on our website, chiraltech.com/method development strategies, we have a flow chart for all of our stationary phases, polysaccharide as well as non-polysaccharide, which contain typical starting conditions, things that you can do to help optimize your separations. Like I said, we'll be going through much of that here. But for those that I don't cover, you can visit our website and see those there. Now, when we begin looking for an analytical method, defining a column for an analytical method, selectivity is obviously the highest importance. We want to try to find a baseline resolution. Selectivity is most affected by modifications to the phase system. So we're talking about changes to the chiral stationary phase or changes to the mobile phase, which is where the effectiveness of the screening approach is really helpful. The small initial screening will be something like 9 immobilized columns, IA through IJ, and then it will include some of the coded phases like AD and OD. And then hopefully we find a partial separation or baseline separation that we can take into the optimization process. When we do the method development, we want to make sure that we keep in mind the chemical nature of the sample. By that, I mean, if we have a basic molecule, we want to add a basic additive. If it's an acidic molecule, we want to make sure we have an acidic additive. There are some secondary interactions that can take place on the column that will cause either peak broadening or peak tailing, that the addition of these additives can help improve that peak shape. And then, of course, if we don't find a separation on the initial screening, we can look to a secondary screening, which usually encompasses just the additional coded phases, as well as potentially some of the specialty columns, which we won't cover today. But the primary screening set looks something like this. I mentioned already all of the mobilized columns, IA through IJ, and then some of the coded phases. And I have marked off here in yellow 4 columns in particular, IA, IBN, IC, and IG. One of the questions, aside from what column should I use to separate my compound, that we most frequently get asked is what is the minimum number of columns that I should use for screening? And these are the 4 that we most often recommend. Not that the others aren't good, but we find that these 4 generally give a wide range of selectivities over a broad range of different compounds. Interestingly enough, they're all kind of connected in that the functionalization on the phenyl group, the phenyl carbamate, at least has one functional group in the meta position. So IA, IBN are again both 3,5-dimethyl phenylcarbamate. Methyl groups are both in meta position. IC, both chloro groups in the meta position. IG is 3-chloro-5-methyl, again, both in the meta position. So very interesting kind of meta effect, but that's generally why we recommend those columns as a minimum set of screening conditions. As far as mobile phase combinations go, for coded phases and immobilized phases, normal phase, polar organic mode, and reversed phase look the same. Normal phase is going to be hexane alcohol, either ethanol or IPA mixtures. Polar organic mode is 100% acetonitrile, methanol, or ethanol. And then reversed phase is going to be a gradient of methanol and water or acetonitrile and water. We usually will try to convert that gradient into an isocratic method for final delivery to the customer, only because running repeated injections on a reversed phase gradient takes longer, having to have that built in a re-equilibration time at the end of the method before you make your next injection. For immobilized phases only, we have access now to the extended range mobile phases, things like combinations of hexane ethylacetate, THF, dichloromethane, chloroform, and methyl tertiary butyl ether. Now, if we do a screening, this happened to be under normal phase conditions, 50-50 hexane ethanol with 0.1% TFA and DEA. This is very often what you will see after that screening. You will see some cases where there's no separations. You'll see cases where there's almost baseline resolution, but some tailing perhaps. You'll see some partial separations, 50% or even just a hint, maybe 10% separation. And then down here on OZ, you'll see a full baseline resolution, something that can certainly be optimized to help cut down on this analysis time. So with these three different scenarios, partial separation that's baseline, almost baseline, a partial separation that needs a little bit more work, and then a full baseline resolution, where do we begin in terms of optimization? The easiest things to check are obviously the mobile phase composition. If you've got a 50-50 mixture of hexane and ethanol, you've got a lot of room to obviously improve the analysis time by either increasing the amount of ethanol, or you can increase the retention by increasing the amount of hexane. We can look at temperature. Temperature can be helpful, and sometimes temperature can be not helpful. And then column length, for those separations that are almost baseline, simply increasing the column length can oftentimes yield a baseline resolution. But whatever you choose to do, it's important that you implement what we call a central composite design rather than a random walk approach. The central composite design, I won't go into it in too much detail. A colleague of mine, Bill Champion, did a full method optimization and validation webinar back last year, which covered this. But basically what we want to do is change parameters, but we don't want to change too many parameters at once. We want to be able to have a good grasp on what parameter of the separation is really having an effect. And so it would look something like this, where if you had an initial screening at 25 degrees Celsius at 50-50 methanol ethanol, you could change the mobile phase composition at 25-75, for instance. But you'd want to have a second point where you went from 15 degrees C to 35 degrees C, but you kept the ratio of mobile phases the same. This allows you to check to see what kind of influence temperature has, for instance. This, as opposed to what I said with a random walk approach here, where you kind of would be kind of all over the map. It might end up being that you find a good separation, say, at B prime. However, you don't know whether or not it's temperature necessarily, or if it's mobile phase composition that's giving you the better separation. And you also don't know how sensitive this separation is. If you were to go perhaps to 70-30, would you completely lose the separation? Or if you went to 35 degrees, would you lose the separation? So use some experimental design. It would potentially help you in the long run with developing a robust method